Hello learner, today we are going to discuss about status of women's health, and I'm Pradeep Kumar. With us Dr. Sarda Prasad ji as a expert for the issues. So today we will go little bit about the program. The MADVS learner and other learners who are opted for MDV 115 content. So our purpose is to make acquaint you with the concern, the status of women and health. Status of women's health is very important because in our society the status is associated with the health concern. Women's situation, women conditions can enhance, can inferiorate. It depends on the social conditioning. So before that I will come to the program. MADVS briefly discuss about the program. There is MADVS MA program comprising various courses of development studies like major development thinkers, theories, issues, challenges, and different papers are there. Like it has issues and challenges, gender, research methodology, health and development, and other optional courses. So it will enhance your today's development situation, and MDV 115 is one of the course in second year. And this is very interesting because health and development deals a lot different aspects of health and development covered in this course. So we will discuss mainly there is 5 blocks within this course, and all 5 blocks covers different issues. First is the introduction about health and development, how situation of India and abroad moving ahead, health and development situation including demographic aspect, and with us Dr. Sarda Prasad is expert of this demographic and population concern. He can talk how demography is linked with the women's health.
Dear learner, you know that women are more vulnerable in most of the times in the society, and women, due to their emotional content or emotional behavior, they don't care about their health. And you know that because of this, the most of the women are not caring about their health, and that is the consequence of that. Their health will be deteriorated due to day by day. The first is the most important the cause why the women's health is poor in India, with respect to all the world. As a WHO report says that India and China is more women's health is very vulnerable as compared to other countries. As compared to China, India is more than other Asian countries. The most of the diseases among the women are malnutrition, and you know that malnutrition is that means there is anemic. Most of the women are anemic in Indian scenario, and because of this, why they are anemic, because their feeding habits are timing of the feeding is very different, and many of the times the domestic violence or domestic discrimination in terms of the feeding their from the childhood to the younger age, and these women are not caring their health food timely because of their care of the children. After marriage, they care their in-laws or father-in-laws, mother-in-laws, and from childhood till marriage, they are caring about their parents, their brother, their sister. If the women is just younger in the age, they may be caring by their elder sister, mother, and grandmother. But if he or she is the oldest or elder in the household, they is caring about the others instead of their health. And the timing of the feeding is different. That's why their health. And most of the time, you know that women's, if we see in the report of the WHO, critically says that the women's are more discriminated by the other family members because of in terms of the nutritional status. If the female is sick in the household, so their caring is very less as compared to the male children or male member in the household. So that is why the most of the time the female is more vulnerable as compared to other female society. So I just request Sir, Pradeep sir, sir, what is the main cause of the malnutrition in India among the women? As if you have, please highlight on the some issues.
Basically, malnutrition, one of the important reason, as you have highlighted, major reason, as you said, the social and cultural factor. The social cultural factors are associated. If they don't get appropriate intake, the problems will come up. So in this regard, in block 2, we have focused on the children, reproductive health, child health care, and adolescent, 3 categories, as well as the last, elderly health care. The 4 component covered in block 4, an issue has raised in this concern, but focus is given to Indian context. In Indian context, as I said, social and cultural factors are very strongly related with their deprivation, poor health, and in particularly in rural area, our culture doesn't allow or empower women. Rather, you must have heard that some area, female infanticide is alarming. You will see the sex ratio. Sex ratio is an indicator of the the ratio between male and female children. So all science says they born equally, and female girl child have more susceptibility, even they die because of female infanticide. And this is a very alarming condition in the northern Bihar, in some region of Haryana. Luckily, this is not in Haryana or hilly region. So cultural factor play a very important factor. That's why I will say the gender. Gender is an issue which again related to socio-cultural factors, and poor gender ratio indicate what is the situation of sex ratio between male and female. Now the time is changing, and people are now taking care, and female girl child are empowering. Though old culture has hampered our society a lot, the thinking of the girl child is poorly. It is changing. Now girl child coming out of home for education, and these are very positive things. But unless sex ratio will not show the equal parameter, then it is very difficult to say that it is equality or women empowerment. It is concern of the women empowerment. So gender is one important issue. And what is gender? Normally people think gender means sex. It is a social construct. That means social and cultural construction of female and male identity. It is not the same as sex. Gender is determined by conception of tasks, functions, and roles attributed to women and men in society, in public and private places. We know very well, we restrict women, girls, from public places. And nowadays also the incident of crime ultimately affected. We should not allow it. But situation is changing, and all the conceptions are also changing. So first, the gender issue, the most important, and you must remember few years back, present government has initiated a policy, Beti Bachao, Beti Padhao. Why this program launched? And the situation has changed and changing. If you see 1901 census, you will be surprised. There is 901 population of female for this 1000 male population. Why it is changing? and drastically till 1991 it has gone down. So this is a very, very phenomena indicator which we should link, we should think. So culture is the, until unless culture, empowerment, social concern will not addressed, women health cannot go ahead. As Dr. Sarda has said, a large number of female and women are suffering from anemic disease, and it is continue. Even government programs also gives the anemia is the major threat for female folk. So this is the condition, as I think.
Thank you, sir. We have to, in the start this lecture, or you can say this Gyan Darshan session, we have to key in point what are the key concern about the female health. So you know that nutrition is the main concern, and nutrition affect all the factors of the female health, and the main is the nutritional status of the women. That is the first concern of the women health. If you want to a healthy female, or because female, if the society, in the society, if female is healthy or educated, then our generation to generation will be healthy and educated. That is the another concern. And if the nutrition is good, then maternal mortality rate will also decline, and that is the second concern of the women health, because nutrition affect the maternal mortality rate. And most of the time now the government has introduced the Janari Suraksha Yojana that will help most of the times reduce the maternal mortality rate, because that is the very serious condition in Indian scenario. During the delivery of the children, the most of the women have lost their life because of during the pregnancy time they have not taken good or sufficient quantity and quality food. That is the, and third concern, that is a mental health. If you know that if the female is not consuming good quantity nutritional food, their mental will be affected, mental health will be affected. And mental health and physical health not only affected by the nutrition, if they are consuming good quantity of nutrition, but there is a domestic violation and domestic discrimination among the female, that will also affect the mental health of the female. Then reproductive health, if nutrition is not good quantity and quality good to taking by the female, that means reproductive health will not be good, and our children, our generation will be affected. Suppose during the pregnancy time, there is a IFA, that is Indian folic acid not consuming, and good quantities of the calcium not taking. The children when born, that will not be good health, or maybe low underweight or low weight, or you can say that there may be deformities in the bodies. So during the pregnancy time, the female should be take quality food in sufficient quantity. And another, that is the discussion that the socio-economic inequality among the female is also concerned about the female health effect. Female health is not a simple complex, because most of the females are very shy nature. If they feeling hungry, they cannot express that we are hungry. If the other members of the family members are not have had their dinner or breakfast, before that they will not take the food. That is another cultural, what the Dr. Pradeep sir has said, that cultural constraint among the female is also affecting the health status of the women. And the gender disparities, you know that gender disparities we have not feel in the society. You cannot visible in the society, but you can also experience in your home also. because if you are eating the food, your mother will provide first food. Suppose in my home, my mother serve food first to me before my sisters. So that is the also discrimination. You cannot experience in the society, but you can also feel in your home. And the most of the times, if nutrition status is not sufficient, that there is a cervical cancer among the female is more has increasing, alarming in the year by year, and that is the more dangerous disease among the female. That's why if nutrition, we want society, healthy society, so our female or our women should be healthy. And in the conclusion remark, Dr. Pradeep sir request, say what you want to say.
Yeah. Basically, today's topic is status of women's health. So, I will lastly conclude with the determinants. What are the determinants for poor health and bad health? The good thing he has expressed, I will talk about 4 components. One is nutrition. Provision is very important, as socio-cultural factor is also there. Unless society will not change and women empowerment will not come up, then both will be affected, nutrition as well other factors. Biological factors. People think differently, which is about if it is male and female, the biological factors also gap, and it is visible. A most important individual behavior and psychological factors. It play important role of status of women and their health. So you can contact us on the given number or if you could not, then write down one email, that is pradeep@ignou.ac.in. So anytime you can ask questions related to the theme. Thank you.